Becky and Boca here outside of NuWays MD. We're here for the grand opening, so let's go inside and check it out. Okay, I'm here with Jacqueline and Annie, and what are we doing here, girls?
We are here having an opening party for Dr. Shariati. I'm really excited about all the different services we're going to be offering.
It actually just opened this week.
Oh,
so
okay.
We're actually having the experience of ourselves, of seeing like everything, the finished results. So it's actually very nice to see the whole average time, how it came into such a nice visual.
Everything's very pretty here.
Yeah.
I'm here with Dr. Chariati at NuWays MD for the grand opening. And Doctor, you want to tell us about your place?
Of course. So at NuWays MD, we offer a whole slew of different types of treatments, non-surgical treatments, facial and Botox room over here. So we're going to be performing.
I was going to ask you, you do Botox and fillers?
We
and all
do,
that too?
exactly.
Okay.
So this is where we're going to be doing that kind of stuff. Also the hair restoration with PRP, as well as, the vampire facial is going to be done in this room. Mm-hmm. We also have the Thermiva, machine behind you, which is radio frequency for vaginal rejuvenation. Okay. So that's also going to be done in this room.
That uses radio frequency. Okay.
Yes, exactly.
I've heard of that.
So, there's laser that can actually be performed, but it's the CO2 laser. That's the majority what a lot of people are using, and that can actually lead to some scarring, which can lead to pain with intercourse. So there's a YAG laser that's going to be coming out in about a year. It's a Canadian laser. We're going to have that, but this is risk-free, essentially.
Yeah.
Radio frequency, not going to cause any kind of issues or anything. And we've been using it for a couple of years in my main office, and we have testimonials. The patients are very, very happy. We do stem cell treatments where we get stem cells from the patient, from the fat of the patient. We do a little bit of lipo either in the front or in the flank. We take about 60 cc's of fat, we're doing the lipo, and it's just done with a syringe, basically. And then, we treat that, and we get about 6 million stem cells from it. The reason that works so well for arthritis, other kinds of things, when kids get hurt when they're 2, 3, 4 years old, they twist their ankle, whatever it is, they don't even know it. They're back up on their feet like that because they got a ton of stem cells. It's all being sent there. Everything heals so quick, okay? Mm-hmm. Unfortunately, as we get older, not so good anymore. What we're doing in this process is we concentrate all your own stem cells right in the area where the injury is. So it regenerates the tissue. There's actually data that shows it replenishes tendons, meniscus that wasn't there. There's no joint space. Everything is right on top of each other. You do an MRI 3-4 months later, there's actually joint space. The person that we treated about a month ago, he hadn't been running for 3 years. And typically it takes about 2 months or so. It's been 3 weeks, 4 weeks, he started running again. That's a bit unusual. It is going to take a little bit of time, but people are able to get their lives back.
Oh yeah, they've had a chronic condition for years.
Exactly. And the other thing is for joint replacements. The whole thing is like knee replacements. That's one of the most common procedures. We had a patient where she had her right knee done, and she really didn't want to get the left one done because she was having a hard time recovering. She was fine with the left. She got a treatment, a couple, 3 years later, another treatment, so she's able to, hold off and not be able to do that, and she's fully functional. Basically what we're going to do, we're just going to be doing the CoolSculpting procedure on her arms over here, okay? So if we have like a little bit of, flabbiness in the arms, which I'm not really sure if Molly has a whole lot of that, we have the strap over here and it's going to just grab on. They've made their markings and everything. The gel pad is on.
Is it instantaneous? Or?
No, about 6 to 12 weeks, okay, before you see the results. But in that area where this is done, the fat is not going to come back because you've gotten rid of those fat cells.
What do you think about that, Molly?
I think that sounds great.
I have a herniated disc here. I have one in my lumbar too, but that one doesn't bother me. But this here, I wake up every day kind of a little jacked up.
What we can do, of course, we have to take a look at your MRIs and everything to make sure.
I have them for you.
Perfect. To make sure that that this is something that's going to be necessary. But
not with me. But.
I would, of course, but it is something that sounds like that it should be helpful
Really.
because again, the thing with stem cell is just regenerating all the normal tissue in the area and rejuvenating normal tissue in the area. So whatever is going on at this space, the herniation, whatever it is, it should heal, and it should feel much, much better. So we do, a little bit of lipo, basically, and we get about 60 cc's of fat out. First, of course, we numb you up, and we use a very small incision, about, half a centimeter or so to get everything out. then it takes us about a good 40 minutes to treat everything. So we centrifuge, get rid of the fat, and just isolate the stem cells out. So that 60 cc's of fat is going to translate into about 6 million stem cells. So we're going to inject, we're going to take some blood from you, and we're going to take the plasma-rich protein from that blood, and we're going to inject it into the joint space. Okay, that's necessary. Now, the analogy I like to use is, for everything to work really well, the stem cell is great, but we also need the PRP, or the plasma-rich protein. The plasma-rich protein is kind of like the soil, if giving like as far as plants and fruits and everything, kind of example like that. But the stem cell is going to be the fertilizer. So we need the soil, so we're going to actually do the PRP over there, plasma-rich protein, and then we put the stem cell in, and it just starts the healing.
So how you doing now, Molly?
I'm doing great. Again, there's no pain or discomfort. It's just a cooling sensation. That's all I feel.
Okay, we're wrapping up the night here, and it was a wonderful event.
Yes, we certainly enjoyed it. I want to thank everyone for coming. Thank you so much. I hope everyone enjoyed it. I hope everyone got a lot of information about the kinds of needs that they have. Maybe some of the friends, colleagues, someone that knows that they need some of our services.
Okay, thank you.
And also grab your goodie bags, guys. We have amazing goodie bags from our partners. We have Cycle Bar, we have Lord & Taylor, we have Smashbox, that we love Smashbox. Yes. We have also Kendra Scott, and we have an amazing 25% off discount for Dr. Shariati.